Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking to you about the importance of hip internal rotation. Now, for all the athletes that come to the clinic and that come for a biomechanical assessment, I am always assessing hip internal and external rotation. I'm particularly focused upon hip internal rotation because I know that a lack of hip internal rotation can lead to various compensatory mechanisms occurring in other parts of the body. For example, a lack of hip internal rotation can lead to lower back pain. It can lead to knee pain. It can also lead to excessive moments of pronation in the foot, which can lead to conditions such as plantar fasciosis, or even Achilles tendinopathy. Hip internal rotation, as I said, is very important. The hip joint is made up of the pelvis, the femur, which is the big bone on top of the thigh, and this rotates in within the acetabulum here. It's a ball and socket joint. It moves in various different directions. So it's important that it can rotate in and rotate out. For athletes, hip internal rotation is very important when you change direction. So that could be any sport like football or rugby or any sport that requires a change of direction. It helps to decelerate you. Now for runners, hip internal rotation helps to get your hips into maximal extension. If you play a sport such as golf or tennis or any other sport that requires rotation, hip internal rotation helps the forces to be transmitted from the lower body to the upper body efficiently, and you don't get any compensatory patterns occurring. For some of my patients that are bodybuilders that like to do squats, a lack of hip internal rotation can lead to knee pain or lower back pain. Obviously, the actual squat is quite a complex movement, so it could be due to poor form, but it can also be due to a lack of hip internal rotation. A faulty movement pattern can lead to a higher risk of injury. Something else that can occur with a lack of hip internal rotation is adductor strain, so strains on the inside of the thigh. We as podiatrists and physios assess this in various different ways. So we can assess it with the patient lying on their back, and we can assess it with the knee straight and with the knee bent. We can also assess it with the patient lying on their stomach. I'll put up an image in a second where we check the hip internal and external rotation. We can correct this, or we can help to correct this in a few different ways. So there are exercises that you can do with a TheraBand, and I'll put up a video to show you how to do them, which can help in hip internal rotation. There's also exercises that you can do without a band, which involve you moving your leg through hip internal and external ranges with the knee bent and with the knee straight. Now, as I said before, hip internal rotation can lead to foot problems. So oftentimes when patients come to me with a foot problem, I will address the entire kinetic chain. So I may look at the role of the hips and see, is there something that we should be correcting at the hips, or trying to correct at the hips. The other things that you can do for hip internal rotation is you can work on the soft tissues. Now, what I should have said before is a lack of hip internal rotation can be because of a few different things. It could be because of a bony or an osseous deformity. You're either born with a certain lack of hip internal rotation, and that's just what you've been allotted. So you cannot get any more than that. So you get a bony block. But it can be because of soft tissues that are affecting the hip internal rotation. So often we could work on the soft tissues around the hips, and a physio would do some manipulation work around these tissues. You can actually get a foam roller, and you could roll on the side of your hip to try and loosen up some of those soft tissues. You need to strengthen your gluteus medius, which is the muscles right on the side of the hip and the pelvis. That would help give you more stability. There are other things you can do. Now, I've had a patient recently who was getting a lot of foot pain when he was going skiing, and it was specifically when he went into a certain position because he had no hip internal rotation. So he was compensating at his feet. So we had to address his hip internal rotation as well as give him some orthotics in his ski boots to try and aid that movement. Hope this video is helpful. I think I have just literally touched upon hip internal rotation. There's a lot more I should talk about when it comes to hip internal rotation, and I think I'll make another video about this at a later date. Thank you for listening, and I hope you enjoyed the video. Take care. Bye.